Hi, good afternoon, everyone. My name is Dr. Gauri Kulkarni, and I head the medical operations at MediBuddy. Today is the World No Tobacco Day. And this is a very important day for all of us to understand that tobacco has definitely caused great amount of havoc in everybody's lives, and the amount of health repercussions, be it physical health, mental health, and social health, that it has brought in. It is of an important space that we take this day to talk more and more about this, considering that this year's WHO theme is commit to quit, right? We all are committed to quitting tobacco, use of tobacco in the form of smoking or any other tobacco product, and understanding why it is important that we quit, considering the pandemic situation of COVID-19, and what we can do and some of the tips that we can follow in this endeavor towards becoming, free of tobacco, right? So it's important that we take time, discuss about this, bring up questions if there are any, so that we have more dialogue and take a path towards quitting tobacco, right? So in the pandemic situation of the COVID-19, what we have seen is people who have been smoking for a while definitely tend to have more severe form of the COVID-19 infection, right? And that is the single most important reason currently that we are asking everybody to commit to quitting tobacco use, because over a long term, this is going to affect not just from a perspective of pandemic, but also to a large extent in most of the issues that tobacco can cause for us, right? So what are these? Like I'm not sure if everybody understands the gravity of the situation when we talk of, what can tobacco do to us, right? Now, I mean, apart from the greater risk that it has when it comes to the severity of COVID-19 infection, we need to understand that tobacco kills, right? There are more than 8 million people every year all around the world who die because of use of tobacco, and about over a million who actually die because of secondhand smoking, right? So it is that serious an issue, and hence the requirement for discussion, right? Tobacco is known to damage almost every organ in our body, right? It is known to cause like 20 different types of cancers, be it cancer of of our oral cavity, our food pipe, our windpipe, into our lungs, cancer of the throat, to cancer of stomach and pancreas, every part of the body, right? So it is even the reproductive system, the urinogenital system, everything, so it is one of those substances which are known to affect every part of our body, right? People who have been, say, smoking or using tobacco have an increased, almost a twofold increased risk in having strokes. They have increased fourfold risk of having, say, heart disease or a heart attack, right? Smokers are known to end up with Alzheimer's disease. Alzheimer's is contributed because of and has been attributed to smoking as well. Women who smoke, they are known to have a lot of menstrual abnormalities. They tend to have difficulty in terms of infertility, pregnancy issues. If there is smoking during pregnancy, then there could be effect on the fetus as well. Men are known to have impotency or fertility issues if they have been smoking for a long period of time. So smoking as such as an issue has been seen widespread. It has been seen to affect us in so many ways, right? Smoking causes simple things like oral infections, increased abnormal acid release in the intestines. It can affect the pancreatic function and the function of digestion itself because of abnormality in the release of digestive enzymes and juices, right? So it's been associated with chronic gastrointestinal problems such as inflammatory bowel disease. So many of them, right? So it's important for us to understand that tobacco itself can not just affect in terms of cancer, because we only think of cancer, right, as tobacco being the most important cause. But then, it can, for example, affect our bone density. It can affect our skeletal system, musculoskeletal system as well. People who have been smoking for a long term are known to have something called as osteoporosis, or increased fragility of bones or fractures. So there's so many things that tobacco can cause, and I think it's important that we understand the gravity of the situation. All right. you know I mean, quitting, it's easy for me to say that, well, one should quit, but the what did I say? The reasons why we could be quitting, right? For example, what are the good things that can happen if you just decide that I'm going to quit today, right? Just the benefits, the health benefits that can come up. Let's talk about basically the physical health benefits, right? To begin with, the moment you decide that I want to quit, right, the benefits start then and there, right? You start seeing the positives of quitting tobacco within minutes, right? Within 20 minutes, your heart rates, your blood pressure start dropping, right? Because that's what tobacco does. It increases your blood pressures and heart rates. So the first thing that will happen within minutes of you deciding that I'm going to quit, I'm not going to smoke anymore, is that you'll be just bringing down your heart rate, your blood pressures over a period of time, right? Within a day, like, you will see that the carbon monoxide levels in your blood will drop, right? That will happen. Within a couple of weeks, you will see that your circulatory system is functioning better. Your shortness of breath has reduced. Coughing has reduced, because there's a lot of spasm in your airways because of, say, suppose you're smoking, and that can also within weeks come back to normal. Within a year, your risk of having any heart disease almost becomes as half as, say, somebody who else is a smoker, right? So to that extent, the moment you pick up the process of quitting, you will start seeing benefits, right? Within five years of quitting smoking, you will see that your risk of having a stroke reduces to that of a non-smoker almost, right? So it's that great. Within 10 years of quitting smoking, your risk of having any cancers, right, becomes half of that of what a smoker would have a risk of. So that's great. So, the benefits of smoking are much more than just the physical benefits that we see, right? From a mental health perspective, I think over a period of time, once you start quitting, you will see that your anxieties have reduced, you're becoming more calmer. There has been association with depression and smoking as well. So that, the mental health, the agility also increases, your productivity increases, procrastination reduces. So in many ways, smoking can help in your mental health as well. Financial health, I think we tend to not talk about it as much, but I feel that people who take the decision to quit would definitely be saving a lot of money, and most probably using this money for more important things in terms of their health, or for their well-being, or for their families, right? So a huge a plus point when you're quitting is you will be also improving your financial health and also your social health, because your social circle will become that much more richer when you quit. And also that you will be actually protecting others by quitting smoking, because then you will reduce the risk of secondhand smoke or passive smoking, as we say, right? So there'll be so many things that you can do when you think, or the benefits that you can get when you even start thinking or start the process of quitting, right? So there are so many things that you can do, given the given that the motto or the theme for this year is committing to quit, right? Now, apart from understanding that it can affect all our systems, and of course it can have a higher risk when it comes to the COVID-19 infection as well, I think few things that I would want to kind of focus, and which we don't talk about as much, when of the ill effects of tobacco as well. I think, and I think it should be highlighted. I think a lot of issues that people face because of tobacco and smoking from a skin perspective, right? A lot of, I mean, I would want to bring out certain things which we tend to not talk, and we only talk of cancers. And it's important that we highlight these as well. So one of the important things that we miss out on is that smoking and use of tobacco in any form tends to affect your skin a lot, right? There is increased aging of skin, which means that, more wrinkles, and one starts looking more older faster, right? And premature aging, as we see, of the skin happens because there's a lot more wear and tear of the proteins around your skin. So that is also something that happens with chronic use of tobacco. It, of course, tobacco has smoking over a long period of time has been known to be a risk factor for development of certain skin illnesses, say inflammatory illnesses or psoriasis or itching, oozing patches that may be happening, right? So a lot of we don't tend to focus a lot much about our skin, but yes, smoking is known to affect skin as well. When we spoke about the secondhand smoking, right? When I say secondhand smoking, are those non-smokers who get exposed. So for example, say children in the house or people on the street, who are exposed to secondhand smoke. And this is a huge number, right? Globally, it has been seen that over 1 million people die because of secondhand smoke. And that's a huge number, right? And because of definitely not their own fault in that sense, right? People who are, of course, exposed to secondhand smoking also have an increased risk of poor immunity. A lot of people who have been exposed to passive smoking tend to get chronic lung infections, say, for example, tuberculosis, or they may have an increased tendency or association with other chronic ailments like, say, high blood pressure or type 2 diabetes and so on and so forth. So it's important to understand that people who are into passive smoking also can be equally affected as people who are using the smoke or tobacco themselves, right? And especially these are children, and because who would much more exposed to passive smoking, they tend to also have a lot of chronic lung ailments or respiratory disorders as they grow up into their adulthood as well. So definitely passive smoking is something which can affect your children, or it can affect people around you, and also one of the reasons that one might want to quit, right? So that is something which is very important. I think apart from all of this, a lot of mental health changes, because there's one is mental health, also is social health, right? A lot of people who smoke are typically, there is a little stigma around it. So naturally there is, you don't, as a smoker, you may not be putting the right example in front of your children or in front of your loved ones. And there could be, definitely, it may be looked at negatively when it comes to social relationships, or if it can affect interactions between people who may not look at it the way you may experience smoking, right? So it's important. It may to some extent also restrict, say, social meeting, and hence may lead to feeling isolated or feeling separated from the community or social community as well. Naturally, quitting would lead to being more productive. You might be able to communicate better in the community itself or in your environment itself, and hence that is also definitely a good reason for you to quit, right? As I was talking about expenses, I think tobacco definitely burns a big hole in the pocket. It is an expensive thing, and we have seen that it and to add to it, it will also cause health related issues with long-term use of tobacco, right? And hence it's important that we look at it from that perspective. The amount of money that we would be saving by stop or by quitting would definitely help in the long run to improve your health and the health of loved ones around you as well, right? The other things that we talk about when it comes to smoking itself is, as I had mentioned before, right? Smoking, especially in women, right? Women who smoke tend to have infertility issues. Women also have a difficult pregnancy if they, and they may have premature births or children with with birth defects, or miscarriages also can happen because of continued smoking. So it definitely affects women more, and especially during their reproductive age. So it's also a good idea, if women are smoking, that they should quit. For men, also, smoking over a period of time has shown to cause erectile dysfunction, impotency, a lot of sperm issues in terms of reduction in the quantity of sperm or the quality of sperms itself, and leading to infertility. So I think it's important that men think from that angle in terms of wanting to quit. Okay, so definitely that is something that everybody should think of. Okay, now one of the other things that I keep telling people is that we, of course, there are so many cancers that it can cause, and I think before we talk about cancers, and I would want to bring it up, let us talk about what it can do when it comes to, say, it is known smokers are known to have visual problems, hearing problems, increase in blood pressure because of smoking can lead to certain eye issues, or which we call as degeneration of the cells in the eye, leading to poor vision, right? So that is also something that can happen in people who have been smoking for a long period of time, right? So there is a huge effect there. Now, effect of smoking especially has been seen because there is development of what we call as Alzheimer's disease as one ages. So a lot of people have seen there is degeneration of neuronal cells and leading to forgetfulness and what we call as Alzheimer's disease. And it has been so shown to be associated with use of tobacco, right? Of course, let us go on to talking about cancers. I think there is, I think tobacco is a deadly thing, right? It is known to cause cancers of all types, everything, right? From your, how can I say, cancers of even on the lip, right? On the skin and lip, to the mouth, the throat, the voice box or the larynx, as we say, the food pipe, the windpipe, the lungs as such, the stomach or the gastrointestinal symptom, gastrointestinal region as well. It is known to cause blood cancers. It is known to cause, kidneys and liver and pancreas, and the rectal cancers, ovarian cancers. So it's known to affect almost every part of our body. And I think it is so important that we understand that the amount of burden that we would be creating, not only for ourselves, but for the people around us when we do end up suffering any of these illnesses, because it can strip you of, one is a poor physical health, but also it can affect so many spheres of your life. And I think it's important for us to ensure that we understand how serious long-term tobacco use can be, and how much of effect it can have on our body. And once we have that in place, I think that is when, once we understand this, that is when we think of what we can do to start even thinking of quitting, right? So I think it's even before I can behaviorally put into practice quitting, I think the thought process has to come, right? The antecedent thought that, oh, I think it is required for me to quit because of so and so reason. When you have a compelling reason is only when one would want to quit in the first place, right? Now, the reason can be something which is self-motivating, which is coming from inside in terms of, say, poor health or something else. But it could be for extrinsic as well. Say, I would want to do it for my child, or I would want to do it for the good health of the family, or some such thing, right? So it depends, or I would want to do it for the environment, either which ways. Like, I think as long as we have a strong enough reason and antecedent for us to want to quit, that is the first step into, the first and the most important step, I feel, also to get into the process in the first place, right? Now, it is never easy. Okay, it is, I think when I say that you are brave when you're committing to, your goal of quitting, it is me saying very less, right? It is courageous for you to take that step. But once you've taken that step, you need to understand that this is the biggest step that you have taken for the goodness of yourself and everyone around you, and that makes you a warrior in itself, right? So that is something that you need to keep telling yourself and motivating yourself. A lot of times it helps to have a partner. A partner could be a professional, maybe your treating physician or your counselor, who's there with you in this journey, right? Because quitting after a long time may not be easy, and sometimes you would want to talk about it. You might want to just express or vent out your feelings during the process of quitting, right? So it's always okay to reach out for help and have a partner in this. Okay. Now, the first step to quitting is, of course, to set a quit date, right? That, give yourself that period that this is from today, I'm not going to smoke, right? That set that date. So you have that day, that this is the day that you're going to start quitting, right? So I think when you have a start date, then you are able to kind of tell or take steps that is required to start from there, right? I think the most important step that I usually tell people to do is to tell people around you that you're quitting. It is important that you tell your friends and family, loved ones, if your co-workers, because a lot of your behavior is around the smoking itself, right? Say, be it, for example, of course, it's the lockdown situation and we are in a situation, in the pandemic situation, but if smoking means that you have to go to a certain place to get smoke, or you have to meet somebody to get to smoke with, or you have a certain timing, or a certain process around smoking, then we need to let people around you know that, so that that can also be broken, right? So people around, if they know that you have taken a quit date and you are getting into this process, it's important that you inform them, right? Inform them so that they can be your motivation, they can be your support, they can give you the encouragement that is required, and also they are the ones who will not give you the temptation, right? A lot of times, even if you have, say, colleagues who are smoking, and maybe they are your partner in smoking, then it's important that you tell them that they should not bring the topic of smoke in front of you, because that can lead to temptation and cravings, right? So that's something, seeking that help from near and dear ones is very important. Also understand that once you have taken the quit date, anticipate challenges. Challenges would happen, right? You will have triggers, you will have cravings, temptations, and you would want in those times to have some quick kind of a thing, right? Like, the most important simple things that I tell people is, try to delay. If you're having a temptation or a craving, try to push it. Try to get yourself engaged into something else. Typically, people who are quitting smoking, we usually ask them to get into an activity which they like, physical activity maybe, or learn something new which gives them a lot of pleasure, because that helps in a long run to be able to then delay that sense of craving that they may have, right? The other things that I always ask people to do is to get into some form of meditation or deep breathing, because when you quit, or when you begin to quit, a lot of upheavals and emotional challenges also come up, and it's if you have prepared yourself in terms of learning how to do meditation or deep breathing exercises, it only helps to calm you down to some extent, right? So that is something that you can learn from beforehand as well, right? The other thing that you can do is maybe drink water, or have some healthy alternative, like you could have say carrot sticks to eat or cucumber sticks to eat, something that will kind of divert you from that thought of smoking, right? It could also be the other diversions or distractions could be, say, listening to music or taking a shower, or maybe just exercising at home, right? In the current situation, that is something that you can do, and it does help. It does help in the long run. Government has come up with a lot of initiatives in terms of cessation as well. There is a from the from the health national health portal, you could download the cessation program, or you could there are a lot of apps now available which help you in giving you motivational thoughts, or giving you tips on how to quit. So you could download a couple of those apps if that helps you. But I think it's a good idea to have somebody who you can speak to. It's a good idea for you that you kind of talk about how you're feeling. A lot of times having a counselor helps, or even a physician. If your tobacco use has been severe and for a very long time, many a times, you may have to get in touch with a physician, a psychiatrist who would be helping you with certain medications as well. Sometimes that is required, use of, say, nicotine patches or gums, or even there are certain drugs as well which are given to reduce the craving, which happens because when you start quitting tobacco, right? That's something that only doctors can prescribe, and it's a good idea for you to reach out if you think that it is becoming difficult for you to continue to quit, right? So that's something that also you can go ahead and do. All right. So there are a couple of questions. And let me take up the questions. I see the time, and we are already, past 30 minutes already. So let me just take a couple of questions that you guys have asked so that, we can go ahead. Is smoking really a stress reliever? Not really, in my opinion. That's a sense of what smoking does is it increases certain hormones in your brain very temporarily. So you have the sense of relief of stress. So that over a period of time actually doesn't happen. Smoking over a period of time can cause more anxieties. It can cause even other mental health issues as well. So it is really not a stress reliever, in my opinion. Is there any gastric problems by using Nicotex gums? There is. See, you have to understand that even the gums and the patches all have nicotine to some extent, and it will cause you some amount of side effects. I think, sometimes quitting and smoking sometimes has to go cold turkey, and it can be difficult. But if you've been a smoker for a very long time, you need to take these gums or these use of the patches under the guidance of a doctor. So please talk. Yes, there can be side effects because of the gums. So please do not take it on your own. Talk to a doctor who would be able to understand how much you smoke, and then they would be able to let you know how much you can use in terms of the gums as well. There's a question about if father smokes, any impact on wife and child? There is, of course. That's what we call as passive smoking or secondhand smoking, right? And definitely smoking in the vicinity where other people are there can put the others in danger. So definitely, and we know that passive smoking has been associated with like chronic lung problems in children, or it can lead to over a long period of time can lead to, say, chronic diseases as well. We have seen deaths because of passive smoking as well, right? So it's important that people in the house understand this and take care. Okay, so very important. Smoking while only with hard drinks twice in a month is also harmful. Yes, it is harmful. I think there is no way of saying that something is, things which are going to cause you trouble. I think it's best that you should let it go. My question to you would be, if you have to drink and smoke only twice a month, that means you really don't need it, right? It's not something that is a food that you need it. And if you don't need it, then you may not as well use it, right? You could direct your passions into something which is going to make you learn something new, or pick up some new hobby, or something which is more helpful in terms of your health as well. My suggestion to you would be definitely to quit, even if you're taking it occasionally. It's better if it's occasional, that means you really don't need it. So the best thing is not to use not to smoke or drink. All right. um, uh, I really want to quit, but I don't have the mental strength to do it. Any advice? I can imagine, right? But the fact remains, it's great to know that you want to quit, right? That's the first step. That's the first step of accepting that I have a problem and I want to quit, right? As I said, and a lot of times we feel, right, we are not able to get through this. It's always nice to have somebody with you, right? Usually a counselor or a psychotherapist who is there to help you calm down. Reach out to a psychiatrist if you want to, if they can understand the pattern of your smoking, and if you need any drugs to help you through that phase, right? Like, for example, you need either a nicotine patch or a gum, or if you need any other drugs, you need an anti-anxiety drug. The doctor would help you to understand you better, to get through this phase. But I am so happy that you would want to quit. Take the first step. Set a quit date. Understand what triggers your smoking. What are those, who, where, when, why of smoking, right? With whom do you smoke? When do you smoke? Why do you smoke? If you understand these questions, and maybe you can find alternatives to to fill in those gaps, and accordingly, you may be able to quit a little easily. I know it's going to be a task. It is a challenge, but you need to pick up that challenge. It's great. It's great to know that you have taken that step, or even the thought of that step, right? What period can be considered as long period? See, the moment you start smoking, it is going to start affecting you. Okay, so I would say best is to not smoke at all, right? But yes, definitely the effect on lungs is very, very high once you are a chronic smoker for more than a couple of months. Definitely it starts affecting all parts of your body. My suggestion is for you to quit at the earliest, right? There are questions about which doctor to consult. Fantastic. So either you consult for talk therapy, and for motivation, you can talk to a counselor or a de-addiction specialist, or a psychotherapist, or you can, for medication specifically, you can talk to a psychiatrist who also have understanding about de-addiction, and they can help you with medication. So you may want to talk to both to understand how is it necessary for you to be on medications, or it is about giving you psychological support through this process, which can be done by a psychotherapist. Okay. It is almost a month when I last smoked. Can I consider that I have quit smoking? Fantastic. I'm so happy for you, and I think you should take pride in yourself that you have been able to successfully quit. I think you should talk about your story. It's important that you use social media to talk about how you were able to do it. Everybody has their own journey when it comes to quitting. So I'm very, very happy for you. Yeah, I mean, of course, it does definitely means that you have quit smoking. See, relapses are always high, so do not lose your guard. Hold on to the good deed that you have done, and spread the message. This is a purpose for you. If you can spread how you were able to, and spread your story, more and more people will be motivated to quit early on, and make their own health better, and those of others around them as well. So that's great to know. Congratulations, right? Can it help if I reduce the count of smoke to 1 per day? Well, to some extent, definitely 1 is lesser than 10. So it definitely would help. However, if you are able to bring it down to 1, you can definitely bring it down to none, right? It is all about, if you have that in you, you have been able to bring it down. That means you have the courage in you to do it. It's all about taking that step, right? So I am sure that you can, right? So take that step, and you would be able to quit very soon. Okay. How long does it take for lungs to recover once you have stopped smoking? Yes. So lungs usually take a longer time, right? Typically, your symptoms would get better in say 6 to up to a year, in terms of say coughing, or what we call as chronic bronchitis, or shortness of breath. Those are the things which get better in a year's time. And your lungs almost kind of, your risk of getting um, cancers and everything reduces by about 10 years from the time that you have stopped smoking, right? So to a large extent, it can take a long time. It can take a decade plus for everything to come as normalcy stage. So my suggestion to you is that if you're thinking of quitting, then you do it as early as possible, because the longer you wait, and I think any day is a good day to quit, but the earlier you quit, the longer is your life expectancy, the lesser are your repercussions because of the smoking itself. So I think it's a good idea for you to take that step at the earliest. Today might be a good day, right? So that's important that you do that for yourself and for your loved ones as well. Okay. There's a question about okay, there's a question about, I want to quit. I started smoking almost 10 years back. I think we spoke about it, right? That, it's great to know that you have thought about it. It's great to know that you've thought about quitting. We have discussed about steps that you can take to quit, about the kind of professionals that you can reach out to. So take that step, take the support of family and friends in this process. And I'm sure that you will be able to do it. Even if you've smoked for 10 years, it is very, very, very much possible that you can quit. It is just that you have to take that step. All right. Is there any process to reverse the effects of smoking or to make lungs stronger? I think the process would be healthy living. In terms of once you've quit smoking, right? You would have to ensure your nutrition is great, you're exercising, you're doing breathing exercises, opening up your lungs, you're getting good sunlight, a good amount of water intake, sleep, de-stressing. All these things over a period of time will definitely make your lungs stronger, right? So I think the first step would be quitting, and then the next step would be definitely to ensure that you are following a good lifestyle. Okay. Understand that this is a period of great devastation for a lot of us, with the COVID-19 infection going around. We know that it is a difficult time. COVID-19 is a respiratory illness. It is affecting a lot of us. Smoking is a big risk factor in causing severe illness. It's important that you understand this, quit smoking, take care of yourself. With the pandemic, I'm sure that you're all following good COVID appropriate behavior, ensuring that you're masking up at all times, ensuring you're following physical distancing, hand sanitization. So these are important things that you do, considering that the pandemic is around. Quit smoking. It is only going to help you in the long run to stay away from serious illnesses which are caused by tobacco itself, but also, hopefully increasing your recovery or your response to the COVID-19 infection if, unfortunately, you do get affected by it. It's important that you get yourself vaccinated in the scenario of COVID-19. Vaccination will only help you to reduce your, even if you get infected, to reduce your morbidity, your mortality, the mortality rates. It will reduce hospital stays. It will protect other people around you from COVID-19 itself. So ensure that you're taking the right steps in the current scenario, considering COVID-19. And my sincere request to all of you would be to quit smoking today. Today, it's a great day to begin. Please take the step at the earliest. All right. There are a couple of other questions which have come in. Medicines to quit smoking. As I explained to you, that there are certain medications which are available depending on the extent of smoking, or the the chronicity or the duration since you've been smoking, and your ability to quit it. There are certain drugs that your psychiatrist can prescribe to you. These may include certain drugs which are anti-anxiety drugs, or for depression as well, depending on your symptomatology. So do talk to your psychiatrist or a de-addiction specialist who would be able to help you with this. You can also talk to a psychologist or a counselor who can help help you in the journey of quitting, help you keep motivated in this journey, and take you through the process, and make you a successful quitter, right? So that is something that you can do. As I am taking tobacco last 15 years, many times to quit, but still using, please give me advice. First step. I think the first step to understand is, why do you want to quit, right? Everybody needs to have an understanding of why they want to quit, okay? And once that is there, then you need to understand a pattern of the why, who, where, what, whom of smoking, right? With whom do I smoke? Why do I smoke? When do I smoke? How do I smoke? If you understand this pattern, then you may want to look around how you can quit it. For example, the basic things I tell people is, just don't buy, don't change your route, don't go in front of the shop where you usually buy your smoke, or don't, the people that you usually would smoke with, tell them that you're not smoking, so you don't, you tell them, and ask them to, so that they can respect your wish, so that you are able to quit a little better, you have a little support from around people. But if you are feeling that it is becoming overwhelming for you to quit, then do reach out to a psychologist for more help, and a psychiatrist for medications if that is required. So please do that. But I know that a lot of relapses are very common. A lot of people try to quit, but they do relapse. But I think it's a process. Not many people can quit the first time. But once they have their heart and soul into it, I know of a lot of people who have been able to quit as well. So please do take that into consideration, and give yourself that the time that is required in this journey of quitting tobacco. All right. So I think most of the questions have been answered. What I understand is that of course, quitting smoking is not easy, but that is something that over a long term will only benefit you and help you in the process of a good health, right? So ensure that you take a pledge, it being a no, the World No Tobacco Day. Let us all take pledge and commit to quitting, right? If we are smoking, then we commit to quitting. If we know of people who are smoking, then we commit to helping them to quit, right? Helping somebody to quit doesn't mean that we become judgmental, but helping them means that we are empathetic towards them. We help them in their process by, helping them to seek help, seek professional help if required, or respecting their decision to quit and not nudge them into smoking if we are smoking at that point in time, right? So those are the things that we can do to help others who have taken the pledge to quit, right? So I hope that in the current pandemic situation, you take this up, take the quitting seriously, and do what it takes to keep your health better, improve your health, so that this pandemic also is something which will slowly, go away from us, and the devastation that it has caused for us. All right. So take care of yourself, stay safe, stay healthy, stay at home, follow all COVID appropriate behavior, reach out to a doctor, reach out to a counselor, reach out to a psychiatrist online if you think that you need more help, so that they will be able to guide you through the process of quitting. All right. So until next time, take care. Thank you so much for your time. Bye-bye. Bye.
Download the MediBuddy app now. Subscribe to our YouTube channel for more updates.